Hello and welcome. This is Dr. Ignatius Cole, and we are talking today about organophosphate poisoning. So, the organophosphates are usually the insecticides and pesticides which are used in farms and to kill insects. So the compounds can be nerve agents used in war, the G agents like sarin, tamoon, and soman, which saw widespread use during the Second World War, the V agents like VX and VE, and also insecticides. The insecticides can be dimethyl compounds, dicrovos, phentheone, malathion, methaminofos, diethyl compounds, chlorpyrifos, diazinon, parathion, and quinalphos. So, uh, basically, organophosphorus compounds are a important source of poisoning and suicide attempts in developing countries and agricultural countries and societies. So these are the pesticide insecticides, which all contains the basic ingredient of which is organophosphate. These are the nerve agents that were used in the chemical warfare. G agents is where they were first synthesized in Germany, and these are like now banned by UN. But these are tamoon, sarin, soman, and cyclosarin. So mechanism of toxicity is organophosphate compounds phosphorylate the active site of acetylcholinesterase. So they combine with acetylcholinesterase, they inactivate this enzyme. This leads to the accumulation of acetylcholine in the cholinergic synapses. There is excess of acetylcholine, and so there is also the spontaneous hydrolysis of organophosphate enzyme complex allows the reactivation of the enzyme. So the organophosphate, the acetylcholinesterase enzyme complex is gradually hydrolyzed, then the acetylcholinesterase is reactivated. However, there is loss of a chemical group from the organophosphate enzyme complex prevents further enzyme reactivation. This process is called aging. So as aging occurs, the hydrolysis does not occur, and acetylcholinesterase cannot be reactivated. So the mechanism of toxicity is that after aging has taken place, new acetylcholinesterase enzyme need to be synthesized before function can be restored. And the important fact, this is very important, the rate of aging is an important determinant of toxicity, and more rapid within dimethyl compounds, which that is 3.7 hours than diethyl compounds. So aging is rapid with dimethyl compounds, and in case of nerve agents like soman, aging can occur within minutes. So we'll see later why this aging is so important in organophosphate poisoning or toxicity. So this is a chart which shows the mechanism of toxicity of organophosphate with treatment with oxime. So you can see here that after aging occurs, reactivation is not possible even with oxime. And oxime actually reactivates the acetylcholinesterase enzymes, but after aging, the reactivation is no longer possible. Oxime loses its effect. You can see here. And the cholinergic features in poisoning, so both these muscarinic and nicotinic features occur in organophosphate poisoning. So the muscarinic effect are, I used to remember, like a person suffering from asthma. So the muscarinic effect are similar to that, like bronchoria, bronchoconstriction, and bradycardia, hypotension, anxiety, delirium, psychosis, fever, diplopia, biasis, lacrimation, vomiting, profuse diarrhea, salivation, sweating, coma, seizure, respiratory depression. This can be remembered by the mnemonic water, water everywhere. So there's bronchoria, water in the bronchus, there is vomiting, profuse diarrhea, there is salivation, sweating, there is lacrimation, so water, water everywhere. And in nicotinic, there is reduced ventilation, there is tachycardia and hypertension, fasciculation and paralysis, and mydriasis. These are the effects which is caused by cigarette smoking also. So this is a short mnemonic for muscarinic symptoms, the water, water everywhere, slosh, salivation, lacrimation, urination, defecation, GI cramping, and emesis. And for nicotinic symptoms, mother what the fuck. So the MTWTF, so muscle cramps for M, T for tachycardia, weakness, twitching, and fasciculation. So MTWTF. The cholinergic tox syndrome is shown in this picture. If you like to remember this picture, the salivation and bronchoria, the pinpoint pupil biases, the sweating, the diaphoresis, the crying, the lacrimation, the running nose or rhinorrhea, the vomiting, the bradycardia, urination, diarrhea. So the picture is actually a great summary. So now the management of acute cholinergic syndrome. So like every emergency or like every other poisoning, first we manage the airway, then breathing, then circulation, then we give high flow oxygen, we obtain intravenous access, then we prevent further exposure, which is also known as external decontamination. We remove the contaminated clothes and the contact lenses, we wash the skin with soap and water, we'll irrigate the. Then we'll do gastric lavage or activated charcoal only if the patient present within 1 hour of ingestion. Then we will treat the convulsion by IV benzodiazepine, diazepam 10 to 20 mg or lorazepam 2 to 4 mg. Then we'll correct hypoxia, acid base, and metabolic abnormalities. We'll also monitor ECG, SpO2, blood gases, urea, and electrolytes, amylase, and glutamate. There is management of the acute cholinergic syndrome. The specific management is atropine. Atropine is life-saving. It reverses bronchospasm, bronchorrhea, bradycardia, and hypotension, all the muscarinic effects. It does also causes if there is a marked increase in heart rate associated with ischemic flossing after 1 mg intravenous dose of atropine, OP poisoning is unlikely. So you can use this as a test to see if there is OP poisoning or not. Atropine should be administered in dose of 2 mg IV, repeated every 5 to 10 minutes until clinical improvements are occurred. So secretions are controlled, the screen is dry, and there is heart rate more than 80 beats per minute. Very large doses of atropine nearing 500 mg may be needed. So going forward, oxime is also important. Example, pyridoxime chloride or ovidoxime, recommended in severe poisoning, reverse or prevent muscle weakness, convulsion or coma. Reactivation of acetylcholinesterase, which has not undergone aging. So after aging, enzyme is no longer efficient. So after aging, the poisoning becomes very dangerous. It may provoke hypotension. IV magnesium sulfate has been used in animals and some studies, but further studies are needed. Ventilatory support may be needed. Benzodiazepines treat agitation, fasciculation, and seizure. So the intermediate syndrome occurring 20%, there is a weakness of ocular muscle, the eye muscles, head, neck, proximal lips, and muscles of respiration in that order, from the eyes to the head to the neck to the lips. And the ventilator failure can occur. It occurs after 1 to 4 days of exposure, and it usually resolves by 3 weeks. There is no specific treatment. Supportive care is all that we can do and is all that is required. The OP-end, the OP organophosphate induced delayed neuropathy. It occurs after 2 to 3 weeks and it is a mixed sensory and motor polyneuropathy. So what happens is after 2 to 3 weeks of organophosphate poisoning, there is muscle cramps, there is followed by numbness and paresthesia. It proceeds to flaccid paralysis of lower and subsequently upper limbs. There is gradually wrist drop and foot drop. The person has high stepping gait, which proceeds gradually to paraplegia. Sensory loss may be present, so sensation may be lost. Tendon reflexes are reduced or lost, but later on can become spastic. So there is no specific therapy for organophosphate-induced delayed neuropathy. Regular physiotherapy should be done. The recovery is usually incomplete, but substantial functional recovery occurs after 1 to 2 years, especially in those younger patients. So we can see this picture is actually the gist of today's presentation. So organophosphate bind cholinesterase, acetylcholinesterase, preventing breakdown of acetylcholine and causing accumulation of acetylcholine. So acetylcholine acts on muscarinic and nicotinic receptors. So the nicotinic receptor has both sympathetic and parasympathetic components, but the muscarinic has only the parasympathetic action. So the dumbbells as sludge are the mnemonic. Dumbbells meaning diarrhea, urination, meiosis, bradycardia, bronchospasm, emesis, lacrimation, lethargy, salivation, and seizures. And the sludge is another mnemonic: water everywhere, salivation, lacrimation, urination, diarrhea, GI cramps, and emesis. The treatment is atropine, so the dose is titrated to drying of bronchial secretions, and pyridoxine helps to regenerate cholinesterase. Thank you. This is Ignatius Cole. Please subscribe to my channel for further